So this question was basically looking at a stimulus material, sometimes called an infographic because it combines information with images, and basically looking at telehealth, which we kind of looked at it towards the end of chapter 11 when we were looking at access to health services. And we come across this term telehealth a lot more, especially having lived through the whole COVID pandemic and understanding that everything was different. The way that health services and healthcare was accessed and delivered was very different. Okay. And if you'd ever wanted to book a doctor's appointment in the last few months or middle of last year when COVID was at its peak, a lot of doctors would have asked you to book a telehealth appointment, which is when you basically call the doctor over the phone and you speak to them over the phone. Okay, now with a question like this, you don't have to first define telehealth separately. Okay, you just need to link it back to health and well-being. However, if this was a part of a multi-part question where part A was define telehealth, this could have been part B, explain how the use of telehealth. But this is just a standalone single question here, so we don't need to stress too much about defining telehealth. We just need to link it directly to those two dimensions of health and well-being. Okay, so I'm just going to show you guys a sample answer straight away. So my answer is just focusing on mental and physical, but you can focus on any two dimensions you want. So this is just the same way we've always gone about it. We underline or we indicate the name of the dimension, and then we link that name of the dimension to the topic that the question is talking about. In this case, it's telehealth. So the answer, this could be a possible answer. Being able to still access GP or doctor services during lockdown periods would have helped people to feel less stressed or less anxious about any health issues they were facing, which helps to increase their mental dimension of health and well-being. So in this answer, we can see that the key words are less stressed or less anxious. Okay. And that the dimension of health is clearly stated or named there, which is mental dimension. Remember, in questions like this, you do get marks just for naming the dimension as well. So you need to be really clear there. Furthermore, as doctors are able to provide health information and diagnose and prescribe treatment over the phone, any person who is experiencing early symptoms of illness can get medication quickly or promptly and thus lessen the strain on their immune system. So I'm linking it to a specific physical bodily function there, in this case, the immune system. You could have even linked it to, for example, flexibility in the muscles and joints and how that is improved as a result of seeing the doctor on time, or as a result of the doctor telling you, okay, if your joints are hurting, do this particular exercise. So them giving that instruction to you on the phone could be enough for you to improve that particular part of your body. So anything related to physical fitness, immune system, flexibility of muscles and joints, all of those things can come under the physical health and well-being. And again, we've clearly named the physical health and well-being dimension there, so that gets us the mark there. Okay, so I'll give you guys about a minute to just correct your answer and give yourself a mark out of 4 if you haven't already corrected it. And I'll just look at the other 1 or 2 answers that are in the chat box as well in the meantime. Okay, so now we're going to move on to the next question. Okay, and if there's no issues, let me know if you have any issues with this question. I'm assuming that everyone is okay with it. So, but if you do, just let me know. All right, we're going to move on to the next question. Now, the next question is a little bit different. We're now trying to link back to health status. And if you remember, health status is about all those different indicators that we talked about in chapter 2. Remember, I said when we were covering chapter 2 that even though this is a separate chapter in the book, you're going to use it all year long. And we have been using it all year long. You know, we have been trying to link back to things like morbidity, mortality, all those different indicators that we talked about. Okay, those are the common ones we use, but you know, there are so many in chapter 2. So you can draw or make reference to any of those any one of those health status indicators from chapter 2 in your answer here. Now, it's not just about chucking the indicator in there, but you've got to fit it into your answer in a very nice and logical way, in the sense that it makes sense when you read your answer. Okay, so think about the indicator that most relates to how telehealth would have benefited the health status. Okay, think about the indicator that could be relevant. And this is actually a bit of a tricky question, so you might have to think about it a bit before you start writing. Okay, so anyway, I'm going to put 3 minutes on the clock for this one. So just give me 3 minutes. Okay, so 3 minutes on the clock and your time starts. And again, one more thing, you don't need to include data in this question either. There's no with reference to data or including data. So just talk about the telehealth, whatever the data is showing us, whatever the information, and then link it back to the health status indicator, but no numerical data is required. Okay, 3 minutes on the clock and your time starts now. Okay, so with this question, all we had to do was talk about telehealth and talk about how we think telehealth has helped to improve the health status for individuals during lockdown period. So we need to bring in some indicator here, because the indicator itself will be worth 1 mark as long as you've used it in the correct context and as long as it's suitable for this particular thing. I think most of you in the answers were talking about morbidity, which is a good one to use. In the sample answer, I'm talking about a different one, which is incidence, I think. So we'll look at that as well. I'll just project that answer up for you guys. So this one talks about incidence. So I've written here, being able to use telehealth services if you have flu-like symptoms. And this is another good idea. When you're doing a question like this, even if the question doesn't specify the name of the disease or illness, you can just make it up. You can say, okay, if you have flu-like symptoms, or if you have issues like food poisoning or indigestion, or even if you have something like COVID symptoms, okay, you could mention that in your answer. So if you have flu-like symptoms, means that you won't have to go and wait physically in the waiting room of the medical center. And obviously, if you're just talking to the doctor over the phone and not infecting everyone around you in the medical center, that's going to reduce the spread of infection. And as a result of that, you're going to actually decrease the number of new cases associated with the flu. And we know that the number of new cases is the incidence. Okay, so that's basically another different kind of indicator that you can include rather than talking about morbidity. Obviously, morbidity is fine, that's not wrong, but just to broaden our scope in terms of the other things that we can also talk about. You can even talk about a reduced prevalence of the number of cases. You know, if you're not well, you should be staying at home. That was the main kind of slogan during the COVID times. If you're sick, stay at home, don't go to work, don't go to the actual medical center. So that's kind of the idea, to reduce the overall total number of COVID cases. It's better that people use things like telehealth, and that's why telehealth became such a big thing. So you can see here, compared to from April 2019 to April 2020, we can see in this particular information here that we've got so many more doctors are actually using telehealth, whereas in 2019, all of the standard GP consultations that year in metropolitan Melbourne were conducted face-to-face. Okay, this was before COVID kind of plagued the world. Yeah, so that's the basic idea. So we can see that there's a big jump now because of the situation. So yeah, that's how you would incorporate that. So in a question like this, you would get 1 mark for mentioning the health status indicator, 1 mark for linking it back to the issue that the question is asking, which is how has using telehealth helped to improve that health status? Yeah, so as long as you've linked it to telehealth and you've mentioned the indicator there, you should get 2 out of 2 for this question. It's the same kind of format or the same kind of mark, the way that it's been marked. There's nothing new about it. It's just taking the same basic skills we know and applying them to new topics, okay? If we were applying health status to nutrition in Unit 1, now we're applying it to telehealth in Unit 2. Okay, that's the basic idea. So it's the same basic skills, but just applying them to different topics. Okay, any questions about this specific question, guys, or how we might approach this question or anything like that? No? Okay, cool. So what I'm going to do is I'm just going to stop the recording here.